Topic is all about creatine kinase. Creatine kinase is an enzyme with molecular weight of 82,000 and associated with ATP regeneration in contractile or transport systems, and it occurs in muscle cells where it is involved in the storage of high energy creatine phosphate. So in every contraction cycle of muscle, it results in creatine phosphate used with the production of ATP, and it results in relatively constant levels of muscle ATP. For tissue source, creatine kinase widely distributed in tissue with highest activities found in skeletal muscle, heart muscle, and brain tissue. For diagnostic significance, creatine kinase levels are elevated in disorders of cardiac and skeletal muscle, in myocardial infarction, rhabdomyolysis, and muscular dystrophy. It is also considered a sensitive indicator of acute myocardial infarction and muscular dystrophy in Duchenne type. For pathophysiologic conditions in which elevated creatine kinase levels occurs are hypothyroidism, malignant hyperpyrexia, and Ray's syndrome. For creatine kinase and progesterone ratio, it is useful in diagnosis of ectopic pregnancy. And for total serum creatine kinase levels, it is used as an early diagnostic tool to identify patients with Vibrio vulnificus infection. So, for creatine kinase, isoenzymes, tissue localization, and sources of elevation, I provide here a table in which there is isoenzyme, tissue, look for the location of isoenzyme and the condition associated. So, mo ang table. For CK-MM or creatine kinase MM, it is the major isoenzyme fraction found in striated muscle and normal serum, and it is the majority of creatine kinase activity in heart muscle, and also attributed to CK-MM with approximately 20% and a result of CK-MB.7, and it is normal. For normal serum, it is consist of approximately 94% to 100% CK-MM. For creatine kinase BB, it is the smallest quantity and is coupled with its relatively short half-life, in which it has only 1 to 5 hours, and it results in CKBB activities that are generally low and transient and not usually measurable when tissue damage occurs. And for creatine kinase BB, it is for highest concentration. It is found in the CNS or central nervous system, the gastrointestinal tract, and uterus during pregnancy. Is MB. Following myocardial infarction, the CK-MB levels begin to rise within 4 to 8 hours and peak at 12 to 24 hours, and magnormalize siya within 48 to 72 hours. For sources of error, hemolysis of serum samples may be a source of elevated creatine kinase activity, and also those people who are physically well trained tend to have elevated baseline levels, and also patients who are bedridden for prolonged periods may have decreased creatine kinase activity. For reference range, for total creatine kinase in male is 46 to 171 units per liter ang normal, and for female 34 to 145 units per liter, and for CK-MB it should be less than 5% of total creatine kinase. And that ends my discussion. Thank you.